Greetings, Wellness Warriors. My name is Rhonda Wright. I am the founder and director of Seedlings Place, and of course, your chief plant-based champion and your loving wellness godmother. Welcome and thank you for joining me for our interview style series, Wealthy Wellness Check, because health is the real wealth. So come on, pull up a chair because God wants to share. Well, I first want to reiterate that, like many other chronic ailments and diseases, diabetes can be managed and it can absolutely be reversed depending on the type of diabetes that it is. Diabetes occurs when the blood sugar levels rise above what is considered normal. Measuring blood sugar can be done. You can get an instantaneous reading by using a glucometer. That's when you're sticking the finger to measure, sticking the finger to gather a tip of blood to measure the sugar levels. The glucometer will give you readings in milligrams per deciliter. If it is below 100 milligrams per deciliter, then it is considered normal. If the measurement comes out at 126, you're actually then considered diabetic. Another reading is if you want to find out how the blood sugar levels are being controlled over a longer period of time, maybe like 2 to 3 months. You can then look at the hemoglobin A1C level. That measures the amount of hemoglobin proteins in your blood. That are coated with sugar, and the reading is given in a percentage. A normal A1C reading is below 6%. Unfortunately, we know that levels can rise as high as 14%. It's also important to note some statistics. In the Bahamas in 2017, Dr. Arlington Lightbourne, who's the president of Bahamas Wellness, he's a lifestyle medical doctor. In an article that was written, he said that 40,000 persons in the Bahamas were estimated to have diabetes, and an additional 30,000 presented with pre-diabetes. In the United States, in 2020, the CDC reported that 34.2 million Americans, which is just over 1 in 10, have diabetes, and 88 million American adults, which is approximately 1 in 3, have pre-diabetes. And unfortunately, many of those persons are not even aware that they have it. The previous thought around diabetes, it used to be that since your blood sugar level is high, and we know that carbohydrates release sugar or glucose, then carbohydrates should be avoided. However, the more current or new approach, thankfully, speaks to the underlying and fundamental reasons that cause why people have type 2 diabetes and prediabetes in terms of having high sugar. And that underlying or fundamental reason is directly linked to insulin resistance, which is caused by the buildup of microscopic fat particles inside the muscle and liver cells. The types of diabetes fall along a spectrum. There's pre-diabetic, there's diabetes 1, diabetes 1.5, diabetes 2, and then there's gestational diabetes. Now, pre-diabetic diagnosis means that your blood sugar levels, they are higher than normal, but they're not high enough yet to be diagnosed as type 2 diabetes. And as I said, there are many, most people who have pre-diabetes are not even aware that they have it. As a matter of fact, in the United States, more than 84% of persons with pre-diabetes are unaware of it. Type 1 diabetes develops when there is no insulin as a result of an autoimmune reaction in the body. The body actually has attacked itself by mistake. Approximately 5 to 10% of the people who have diabetes have type 1, so a smaller percentage of persons are diagnosed with type 1. If you do have type 1 diabetes, you will need to take insulin every day to survive. There is no cure to type 1 diabetes. It can only be managed. Type 1.5 diabetes is where a person has developed partial insulin resistance, and that means that some of the cells function normally or they are insulin sensitive, and other cells are insulin resistant. So some work and some don't, so to speak. Type 2 diabetes, which is where, of course, the bulk of persons fall in that category or are diagnosed with, that's where persons have developed full insulin resistance. Your cells no longer respond to insulin. and cannot keep blood sugar levels at normal. The majority of persons fall in the category of being diagnosed with type 2 diabetes, and about 90 to 95% of people are diagnosed with it. It develops over many years. It doesn't happen overnight, and usually adults are diagnosed with it. Unfortunately, though, it is being seen more and more in school-aged children, teens and young adults. So let me first speak to the sugar factor, which of course we know is glucose, which is what is measured to determine the blood sugar levels. We know that we get sugar from our food, and of course that's used by the body to turn it into energy. The hormone insulin is responsible for sending a signal to our cells to tell them to grab the glucose out of the bloodstream so that it can be put into our cells and then converted into energy. So we actually need the sugar. The sugar isn't really the bad guy or the root problem. Now, what would happen under normal circumstances or in the body of someone who is not diagnosed with diabetes? The hormone insulin, which as we said is responsible for sending the signal out to the cells, they act like a key to activate the glucose transport receptors on the cell. So the cell receptors will grab the glucose out of the bloodstream, put it into our cells, convert it to energy. But with diabetes, herein lies the problem. In the case of type 1 diabetes, which of course there's plenty of sugar around, that's not the issue. The cells are ready to accept the glucose. However, the problem is that there is no insulin. There is no key to activate the cell receptors for the cells to open up to retrieve the glucose. So of course, this is why there's a need to supply supplemental insulin for a person with type 1 diabetes, or as I said, they could die. For type 2, diabetes develops as a result of insulin resistance occurring. And again, what is insulin resistance? That is when the cell receptors in the muscles, the body fat, and the liver, they've become inactive. They are no longer sensitive to the signal that insulin sends out. So despite the glucose being there, waiting to get in, plenty of insulin around, trying to send the signal, due to the development of insulin resistance, the cells are no longer opening up. They're not even picking up on the insulin, and so they're no longer opening up to let the sugar in. So in simplistic terms, think of it as a bottleneck that's happening at the cellular level. You eat, sugar glucose is released into the bloodstream as it should be. Insulin is released by the pancreas as it should be, with the job of alerting the cells to open up so that it can so that the cell receptors can grab the glucose to be let into the cells, but the cells don't let the insulin in. So the sugar is then reabsorbed into the bloodstream, thus causing a spike in sugar levels. And of course, since you didn't get the glucose that was needed to convert to energy, you then feel tired and hungry sooner, and you eat again, so the cycle continues. Some of the symptoms that you can experience would be frequent urination, unusual thirst, excess weight loss in the case of type 2 diabetes as well. Loss of vision is another serious symptom that takes place. In the case of heavy diabetes, you can experience major complications because you're ultimately suffering from a metabolic handicap, resulting in damage to all the tissues in the body. But where it seems most frequent would be the eyes, kidneys, nerves, and heart. So in actuality, the underlying issue to be examined at the root of diabetes in most instances is what is the cause of insulin resistance. Ultimately, this is the question that we want to focus on to truly address prediabetes, type 1.5, and type 2 diabetes. This will move us away from just the sign of diabetes, which of course is too much sugar in the blood, to the solution or to better managing and reversing diabetes, which is to develop insulin sensitivity once again. This will allow us, as I said, to really be able to focus on healing. The answer, of course, lies in what I said at the very beginning. Insulin resistance is caused by the buildup of microscopic fat particles inside the muscle and liver cells. And what are the foods that we eat that can lead to this? Well, of course, saturated fats, trans fats, and these are mainly found, as we know, we've talked about consistently, from animal sources, meats, cheeses, as well as fried foods, or foods fried and partially hydrogenated oil. Additionally, there's sweetened drinks like soda, fruit drinks, iced teas, vitamin water, which can all make you gain weight. And we discussed and talked more about this in episode 1 if you wanted to look back at that. So this is why switching to a low-fat, plant-based food lifestyle has such phenomenal results and is now a tool to manage or reverse diabetes. In the case of diabetes 1, while there's no cure, Dr. McDougall, who is a doctor out of the United States, has stated that part of his protocol is to have his patients transition to a low-fat, plant-based diet, which improves the use of insulin in the body. And he has stated that he's been able to reduce the frequency that his patients have to take insulin during the day. Due to the prevalence of our high consumption of refined carbohydrates, fried foods, lack of movement or exercise, lack of restful sleep, and the minimal intake of whole foods, plant-based foods, we're now seeing diabetes in school-age children, young adults, right? Getting away from animal products, animal fat, added oils, really gets to the root of the problem. It's no longer just a disease for adults or the elderly. So many persons are affected by this disease, and that's evident by way of the statistics that were shared earlier. We want to continue to encourage our community to be proactive, as proactive as possible, to avoid finding yourself in this situation. If you've experienced any of the symptoms mentioned, please visit your medical practitioner to determine if you are pre-diabetic or already have diabetes 2. Ultimately, as we always do, we want to remind everyone to put themselves in the driver's seat. Take control. The world needs you. We need you around. We need you to be as vibrant and healthy as possible. Organizations like Seedlings Place, and I am a strong supporter of doctors like Dr. Arlington Lightbourne, who, as I said, president of Bahamas Wellness, who's a lifestyle doctor, Dr. Cindy Dorset, who is the president of Ponciana Medical Center, another doctor that I trust here in the Bahamas. We're all here to support you to create the lifestyle that I know you want and that you absolutely deserve. You're not alone. Just take it one plate, one step, one day at a time.